Over the last few months, as panic over coronavirus has spread, we've seen more and more people wearing masks in public. Meanwhile, we may have heard about shortages in masks and other protective equipment in hospitals, clinics, and other healthcare settings. We are all trying to protect ourselves and our loved ones, but what should we do with masks, and how do we know when and where to use them? We will talk about this in today's video. In order to understand the role of masks in the coronavirus pandemic, it's important to first understand how the virus is spread. From what we know so far, coronavirus moves from one person to another through respiratory droplets, which are small drops that go into the air when a person who is infected coughs or sneezes. This means that droplets from people who are standing close to or within about 6 feet of someone who is infected might land on another person's face. This could cause the virus to enter the new person's body and cause illness. A face mask can serve as a barrier between the atmosphere and a person's nose and mouth. When worn by a healthy person, it could keep droplets with the virus out, and when worn by a sick person, it could keep droplets with the virus in so they don't land on other surfaces or people. However, just like all other things in the world, supply of masks, especially medical or surgical ones, is limited. Because of this, we all have to think about who needs these masks the most and save it for them. But how do we decide who needs masks the most? To do this, we have to understand who in our community is at highest risk of getting infected. Even though there are more and more people every day getting infected with coronavirus, there is no place with quite as many sick individuals as a hospital. The hospital and similar healthcare facilities have a constant flow of people who are sick, meaning those that are working in these settings are by far at greatest risk of catching the infection. Not only are they around people who are sick all day long, they also have to be very close to people in order to examine and treat them. Even though the rest of society can keep a distance from others, especially those who are coughing or sneezing, healthcare providers are forced to do the opposite of this every single day. They have to get close to people who don't feel well in order to help them. Because of this, we all have to do our part to care for those who care for us. It's easy to think that 1 or 2 masks might not make a difference, but each mask we take away is a mask that those who are providing care to others don't have. This one mask could be the one that protected a nurse, physician, or other healthcare provider from getting sick themselves. And this provider could be the one caring for you or your loved ones tomorrow. If our healthcare force goes down, this means that when we or our loved ones need care, there will be very few people or nobody to give it. We will be sitting in a hospital full of patients but no providers, and that's one scary thought. So what can we do? First, we can keep a distance from others as much as possible, which many of us have already been doing so well. We can wash our hands often with soap and water for at least 20 seconds. This will get rid of any virus that we might have picked up from an infected surface. We can also try not to touch our face, because this is how any virus on our hands can spread to our body through our eyes, nose, or mouth. And we can stay away from public places, especially when we are not feeling well, in order to prevent spreading possible infections to others. What about homemade masks, cloths, and bandanas, or non-surgical masks? Even though these are not professional masks, they might be better than nothing at protecting us, but it depends on how we approach them. If using masks makes us feel invincible and leads us to disregard other measures of preventing infection, like keeping away from other people, washing our hands often, and not touching our face, they might do more harm than good. It's like going swimming with a life jacket when you don't know how to swim. No matter how good the life jacket, it will never work as well as staying out of the water. So So while using these types of masks might be a good addition to other safety measures, it isn't a replacement for them. If you do use such masks, make sure to change them often, take them off appropriately, wash them right away, and not touch your face when wearing them. Only by thinking of our entire community can we get through this difficult time. So let's all do our part in protecting ourselves, our healthcare providers, and our community.